The exercise here is the hip extension 60-40. So the difference between this and the normal hip extension is that instead of having similar weight on both heels, we're going to have more weight on one foot instead of the other. So we're going to have like 60% on one foot and 40% on the other foot. And the key point here is to keep the pelvis stable. So while shifting the weight to one foot, we don't want the pelvis to move to one side or rotate. So the exercise goes like this. Come back down on your back here. Bring the heels towards the glutes. Arms across the chest. Tuck the pelvis under, flatten the lumbar spine, tighten the glutes, bringing the pubic bone to the umbilicus. Pushing up high, really keeping the glutes tight. And once I'm in the top position here, I'm going to push one heel harder into the floor, and this will create a shift in the weight. So right now I have more weight on my right foot here, and my goal is to not have my pelvis go to one side or the other or have it rotate. So keep the pelvis stable, bring one heel into the floor, increase the pressure. You should feel the glute on the same side working a bit harder. And then change side here. So right now I'm going to push my left heel harder into the floor while keeping my pelvis stable. I'm maintaining this flat position, making sure that I'm not rotating or shifting my weight to one side or the other. Just bring the heel as hard into the floor as you can without going into this shift. It's okay to go more than 60-40% if you can maintain the pelvis stable. And then come back down. Once again, flatten the lumbar spine, tighten the glutes, bringing the pubic bone tight to the umbilicus. Come up, really squeeze those glutes, then push one heel harder into the ground. And change sides. Push the other heel hard into the ground. Make sure that the pelvis stays in the same position. And come back down. So that's the hip extension with a 60-40 weight shift distribution. During this exercise, some people tend to feel pain on the side of the knee. So just like we did in the hip extension, we can use these 4 variations of the exercise, just trying to activate some muscles more than the others. So the first thing we're going to try here, come back down on the back here, and instead of having the heels tight to the glutes, we're just going to open the distance here just a slight bit, and then do the same exercise. Tighten glutes, bring the pelvis under, pubic bone tight to the umbilicus, push high, and in the top position here, shift more weight on one heel, and then the other, and come back down. So that's the first variation, just increasing the distance from the heel to the glutes. The second variation here, once again, we're going to grab our ball here, come back down, heels close, place the ball between the knees, slightly squeeze the knees together, tighten the glutes, tuck the pelvis under, keeping the pubic bone close to the umbilicus, coming into the top position, pushing one heel harder into the floor here, and change side, keeping the pelvis still, and coming back down. So in this exercise here, we are really activating the adductor muscles. To activate the abductor muscles, we're going to grab the band, place it just on the lower part of the thighs, coming back down, bringing the heels close and keep the knees apart, tightening the glutes, pushing up the hip. In the top position with the glutes really tight, bring one heel into the floor harder than the other. Keep the pelvis still, not shifting to one side or the other. Push the other heel down as hard as you can without going into any tilt. And come back down again. The last variation we have here is the one where we don't roll the pelvis, so we just try to push the hip up, bring the heels close, arms across the chest. So instead of rolling the pelvis, I'm just going to lift it up, but really focusing on tightening my glutes, pushing from the heels in the top position here, pushing one heel harder into the floor than the other, as hard as I can without going into any side shift of the pelvis or rotating. And then changing to the other heel here, pushing it down, really keeping my glutes tight, but I'm not focusing on keeping the pubic bone close to the umbilicus. I'm just keeping my hip up and come back down. So these are the 4 variations you can test out if you experience knee pain during the 60-40 weight distribution. So we want to find the variation that allows you to do the exercise. Have fun.